but it ended up being Walter, being the president who had to pull up America. It was weird. And like Jeff Dunham was Jeff guy from like 24 Hours. What? The guy from 24 Hours. Oh, are you okay? It kind of seems like she's having an asthma attack. Some of the symptoms are coughing and wheezing. And I bet you if she could talk, she'd probably tell us that she has chest tightness.
Her chest is really tight.
Oh, and you can tell from her shortness of breath. Asthma can usually occur anytime in your lifespan during onset. However, certain types are experienced within different ages. Open. Breathlessness.
No, asthma, no.
Another symptom of asthma
is chest tightness.
It ain't easy being wheezy. Coughing.
Within the respiratory system, the trachea branch into two bronchial branches and terminate in the alveoli within the lung.
The function of the bronchioles are to clean, moisten, and warm the air.
The epithelial lining in an asthmatic patient within the bronchiole peels away and is very thin, which makes them hypersensitive to triggers and allergens. And as well, within an asthmatic individual, there's more goblet cells which make more mucus, which makes it even harder for them to breathe. Here's a zoomed up picture of a bronchiole, and in an asthmatic patient, even on a day-to-day basis, their airway is always slightly constricted. And during an asthmatic attack, there's more inflammation and there's contraction of the bronchial smooth muscle, which makes the airway even narrower.
In the bronchioles, in the lower respiratory tract, there's more smooth muscle and less collagen fibers. Therefore, it contracts even more, causing this to be more of an issue in asthmatic patients.
And we'll talk about more of the inflammation later.
So the bronchioles terminate in the alveoli. This is where the gas exchange occurs across the blood-air barrier. The carbon dioxide and the oxygen transfer through simple diffusion across this barrier. It's a simple squamous epithelial cell membrane. The alveolar cells also secrete antimicrobial proteins as a first-line defense. This is actually not different in an asthmatic patient, but less oxygen is able to get into the blood-air barrier to oxygenate the blood.
Okay, so asthma is categorized into two different types, extrinsic and intrinsic. During an extrinsic pathway, the allergens is what induces an attack, and through the intrinsic pathway, it's not an allergen or an allergenic trigger, so there's something else, like exercise. So here we'll talk about the extrinsic pathway. So an allergen comes into the individual, and B lymphocytes produce IgE antibodies. And these IgEs bind to receptors within the mast cell, and this is the mast cells where histamine is produced. And then histamine is then released into the blood, and it causes further bronchoconstriction and inflammation within the airway.
Are you okay?
As you can see, there are many risk factors and triggers to asthma. Genetics, food intolerances, allergens, smoking, pollution, perfumes, food additives, obesity, and exercise.
So regarding treatments, currently there is no cure for asthma, and traditional therapies do not address chronic deterioration of lung function. Current treatments aim to reduce inflammation and alleviate bronchoconstriction. Major goals of current treatments include no daytime symptoms and no waking from nighttime symptoms, no rescue therapies needed, no flare-ups, no activity or exercise limitations, and peak expiratory flow rate or forced entry volume. The most widely used asthma medications available are inhalers with B2 agonists or corticosteroids, which reduce inflammation.
Wait, what's a B2 agonist?
Well, B2 receptors are part of the sympathetic nervous system, and they inhibit smooth muscle contraction within the bronchi. The B2 agonists are often called rescue inhalers and are used when there is a flare-up or an asthma attack. and the corticosteroid is a control inhaler that you normally take every day. So ideally, Mackenzie would take her B2 agonist inhaler which would alleviate the symptoms of her asthma.